Hello, viewers, and welcome to yet another episode of Conversations with Iyobosa. On today's episode, we're going to be having a conversation about healthcare delivery in Nigeria. So when it comes to healthcare delivery, data is king. In the last few years, hospitals and healthcare facilities here in the US, as well as in Europe, have been implementing the electronic medical records system, or what we call EMR system. And this is whereby patients' healthcare records, so everything from your well-checked results to biographical info, vaccinations, surgeries, blood test results, are stored electronically for easy access by healthcare professionals in the treatment and care of their patients, even if the patients have been seen at various healthcare facilities all over the country. Now, imagine if such a system were implemented in the Nigerian healthcare sector. Imagine, one, no more hard paper copy or folders of patients' info. Two, more access to healthcare, particularly in the remote villages and towns. Three, access to real-time data and patients' history and records to enable physicians and clinicians make rapid decisions in the provision of healthcare and in combating disease outbreaks. I mean, the list goes on and on. Get this, viewers. There is good news. Meet Okey Okuzu. He's the founder and CEO of InStrat Global Health Solutions, a technology company in Nigeria using the power of AI, that's artificial intelligence, ML, machine learning, and technology to improve healthcare delivery in Nigeria. Now get this, you know you're doing something right when you are featured on CNN as one of Africa's entrepreneurs disrupting Nigeria's healthcare industry with mobile health. So without further ado, welcome Okey to the show. Really glad to have you here.
Thank you, Iyobosa, and thanks for having me.
Yes. Okay. So obviously that introduction I gave about InStrat is just on a very stratospheric level. Let's bring it down, right? Tell us how you formed InStrat. How did the idea come about, including how your background, so your career as well as your educational experiences come to play.
All right. Thank you very much. So so first of all, let me thank you for the work that you're doing in changing the narratives of Africa enterprise. It's very important work. So thanks very much for the work that you do.
Thank
and for
you.
having me on your show today. So I'm going to answer the question in two parts. First is around my background, and then the next part is how the background influenced what I'm doing today. And so my background is that I was born and raised in Nigeria. And the first part of my career, I worked in investment banking in Africa, which allowed me to travel around Africa and really appreciate the business environment that Africa offered. And this was in the early 1990s. And then in the mid to late 90s, I transitioned over to the United States. I had an Ivy League MBA. And then I worked in healthcare and life sciences in global pharmaceutical companies, namely Pfizer and Novartis. And that allowed me to be exposed to the global business environment, life sciences. And more recently, I'm in the world of technology, and I owe that to my affinity for technology.
Right.
And so why did I start InStrat? In the early 2000s or mid 2000s, three important trends overlapped to present the opportunity. First was introduction and increasing penetration of broadband. The second was the introduction of cheap computing mobile computers named mobile phones. And the third was the penetration of mobile phones, which, quite frankly, leveraged the fact that mobile phones were cheaper, broadband was available. And so this presented the opportunity to introduce solutions that can solve social problems on the back of mobile technology. And that's what inspired the start of InStrat in 2010.
Wow, so 2010. So you guys are going on 12 years now, since 2022.
Approximately, yeah.
Wow, this is going strong. This is awesome. So InStrat, thank you for that introduction to your company. I couldn't have even done it justice. So InStrat, I understand, provide 4 suites of solutions, right? What are they, and which would you say, based on feedback you get from clinicians, is the most impactful, I guess, for this time?
All right, so we do have, as you indicated, four platforms. I'm going to try to avoid describing them in technical language,
right.
just so that the entire audience can can follow what we're trying to share here. Okay. But the solutions that we provide, mostly using mobile phones that everybody has in their pockets, allow us to move information from patients to doctors and back throughout the healthcare ecosystem. And that's what you described in your intro. Right. The second application allows us to train health workers anywhere at any time using self-paced mobble learning applications. Okay. And we deliver audio, video, text with instant training and test results. We do electronic disease surveillance, and we also facilitate health insurance processing, claim submission, and payments. Now, these are the 4 platforms that we directly promote and support. But there are many other services that we also provide in Nigeria and Africa. Now, what is the most impactful? To me, it's a mobile training platform, and that is because in many places where we work, oftentimes in rural settings, the places where we work, there's a low-skilled, poorly trained health worker that's between a person and almost a near certain death. And so in that instance, there are no options. And so if we're able to provide that health worker with critical life-saving skills, then they can potentially prevent the loss of a life. And we have many reference cases, many examples of that, particular scenario where people have relied.
So many success stories, basically.
Oh, absolutely. Where people have relied directly on the training that we have provided to save lives. So we have that documented.
Okay. Wow, that's phenomenal. That is, so I can kind of see how, and it's funny how that's tangible, right? Everyone can relate to that. It's like,
absolutely.
This training you just took, it just translated into you saving a life. I mean, that's epic. This is fantastic work you guys do, truly.
Thank you.
And I imagine your company, because usually I like to, when I discuss with companies or with CEOs and founders, I like to also talk about, their CSR activities, their corporate social responsibility. But your company is it. I mean, it's an embodiment of CSR, right? You're doing good to the community. You are providing jobs, for people. What other aspects of your company? So in other words, how do you collaborate? I imagine you collaborate with the 3 tiers of government and maybe even other NGOs, both foreign and domestic. Can you just talk to us a little bit about that?
That's correct. We have a very complex, interaction or interplay of different stakeholders, from global donor partners to private sector, international, large international companies who are involved in the social investment space, to government entities at the different levels, which is, the federal, state and local, and we work across all of those different tiers. And I think the best description of the structure, the framework within which we work is, the private-public partnership framework. And in that framework, what we do is leverage the best of public sector experience. Contrary to what a lot of people think, there are people in the public sector with deep expertise, deep sector expertise, that is available to be leveraged.
They're in Nigeria, right? They're in Nigeria.
Absolutely, in Nigeria, in many countries in Africa, as I've experienced, and across the world. And then what we do is we bring the private sector discipline, the private sector approach to implementing projects, the private sector accountability. And of course, within that structure, we also, depending on the funding mechanisms, we potentially work within a global or an international financing structure that provides the funding for those projects. But, in my experience, the biggest, the most successful projects have been ones where the private, private-public partnership framework has been well executed.
Okay. So is that, in terms of, I know you mentioned some foreign NGOs that you work with, I guess for lack of a better term. Now, is that how you're primarily funded? And not to go, and feel free to, I don't want to delve into any kind of like,
that's okay. That's fine. Yeah, so the funding structures are multi-stream. InStrat is a for-profit company. And so our structures have allowed us to be funded internationally through international donor partners, both public, such as the US AID, Agency for International Development, the British equivalent, which is the Department for International Development, and other, types of organizations like that, the Global Fund for HIV, TB, malaria, etc. We're also funded in Nigeria by the Nigeria's Federal Ministry of Health directly.
Okay. Well, that's great.
We also have state government projects where we're funded directly out of state budget, state budget lines. But we also have private sector hospitals, etc., that fund the projects that we implement or the services that we provide for them. So we've kind of set ourselves up to really take all of the above, project financing, approach.
Right. And it's truly amazing work that you do, because for you to be, how did it feel to be recognized by CNN as, one of Africa's, so not even just like Nigeria, one of Africa's, leading health tech disruptor?
Well, on one hand, it was really, I was humbled by it. Obviously it's quite a recognition to have. I was humbled by it, but I also would like to just add that, I don't do this work in a vacuum. I work within a structure with, colleagues of mine within InStrat that do the amazing work every single day on the ground. I work within a structure of partners, collaborators, right? And so, that recognition, quite frankly, is a recognition of the entire set of people.
Ecosystem, right.
Absolutely, that we work together to make that impact. And so if I was on a stage accepting an award, I would dedicate that award to all the people in that ecosystem. I kind of think, unfortunately, the framework for that recognition wasn't such that all of us could be recognized. But I do want to just, say that I don't do this work alone. in some ways I'm a catalyst, but it really takes the entire ecosystem to create the impact that led to that recognition.
Right, right. But it says a lot, and I hear you, but it does say a lot about your leadership, because it begins from there, right? It's all about the tone from the top. And it says something, it definitely speaks volumes, for you or your company to be able to get that, to have gotten that recognition by CNN. So kudos. I still say kudos to you guys.
Thank you very much. But I also do want to say something about leadership. It's, I appreciate applying that term to me, but I also flip that on its head and say that good leaders serve.
Yes.
And I live to serve my ecosystem. And so thanks though.
Okay. Now, I imagine the business model you have currently in Nigeria can also be applicable to other developing countries, right? Have you thought about that? Now, maybe you have, what are your thoughts?
Yeah, no, I mean, I've thought about that extensively. We have done work across countries, across continents. There are many platforms that are dedicated to providing service structures or service platforms that are applicable across continents, and there are many of them. I give examples. A lot of them that we actually have as business partners.
Right.
So there are three critical building blocks that make this possible. Mm-hmm. The first building block is cloud computing. It's where applications run on computers that are hosted in the cloud.
The cloud.
We can have another discussion of what exactly cloud means.
Right.
And so what that does is it transfers the power of computing off to much more powerful systems, right? And so the second concept is the mobile computing, which is that you have your smartphone using applications to push data from your phone to the cloud application. And so the cloud allows global scale, allows scalability. The mobile computing platforms really democratize the accessibility of those applications, because everybody has a phone. Applications are typically very intuitive and user-friendly. And so, Facebook or Instagram is one of those where, those are platforms that are deployed globally.
Right.
So we have many health applications. And the third, and probably other important building block is that language translation applications make it easy to deploy the same content in different places, in the same context,
right,
but accessible, really quite frankly, across the global south. So we have done, deployed across borders, and the applications that we work with are quite frankly deployable and accessible around, across the global south. And the global south, I mean South America, and shout out to my brothers and sisters in the Caribbean, Africa, and South Asia.
Okay. Yeah, no, that's phenomenal. And now, what about in terms of disease outbreaks? Do any of your current solutions or products, right, offer a solution in that arena, or is there something in the development pipeline?
Thank you very much for that. No, this is actually the one that currently excites me the most. We have an early warning outbreak recognition system.
Oh,
and
wow.
the quick background to that is that in a lot of instances in Nigeria, it used to be the case that people knew of outbreaks when a critical number of people died, and then it got the attention of the communities and the health authorities.
Yeah, so
And
it's like after the fact, it's already too late, It's like, yeah.
Yes, it's already too late. And so kudos to the Nigeria Center for Disease Control. They've essentially digitized and put in electronic, case management systems, to digitize the tracking of disease and disease surveillance data. And so all of that's done. And so the tracking of outbreaks and response is significantly faster. And so what we're doing, where we're adding to that science, or to that state of practice, is to bring in artificial intelligence, to help, identify disease outbreaks based on the potential. And so we have a system that would pick through big data, identify patterns of data that would potentially suggest an outbreak. So I'll give you an example. So if we're in a certain community, and all of a sudden there is a spike in, say, a diarrhea medicine, and we know that people take those medicines to treat diarrhea, and there's a massive spike. It could be the early warning signs of an outbreak in cholera, right? And so we are then able to take that and notify disease authorities, then potentially they could take preventive action. And so what we've done is develop this system, and we've actually worked within a consortium led by KNCB TB Foundation under a USAID-funded project to deploy this for TB surveillance and case finding across Nigeria. And I'm happy to say that using our technology, we're actually able to double the number of TB cases found in the places that our systems detected the possible local outbreaks or existence of cases that weren't detected. So we doubled the findings in those places versus other places that our systems didn't direct them to. And so on the back of that, Nigeria's national TB program has decided to scale this system across the entire country. And we're also now trying to work on mechanisms to bring this, to introduce this to other countries across Africa and other TB endemic countries around the world. But also, I should say that this, you've also talked about things that we may have in development, but this is actually really cool that we're working with, InStrat is working with the University of Texas, Southwestern. Yeah, and we're working on an infectious diseases predictive model. So this is a model that would predict the outbreak of a disease based on historical data patterns, based on based on also things like population demographics, density, weather patterns. Those types of things would then allow us to predict the outbreak of infectious and non-communicable diseases as far as 3 to 6 months. And so we've run versions of those models, and they actually are predictive. And so we're looking at going out to test and validate the models later on this year. And so if we're able to do that, then we can potentially identify an outbreak even before it happens.
Even before it starts,
Yeah, and so in the best of all worlds, and when I talk about this, people laugh, but in the best of all worlds, our models will always be wrong. Because if we tell you this outbreak will happen if you do nothing in 3 months, but we also will have the recipe of things that you can do to prevent those outbreaks. And if you do those things we present on the recipe, then the outbreaks won't happen, and therefore our models will be wrong. But if you do nothing, you will have those outbreaks. So it's a very exciting field of work to be in at this time, and I just count myself as being very fortunate.
Again, it just it goes to show the fact that it's not for nothing. You're one of Africa's health tech disruptor.
Thank you.
I mean, this is phenomenal.
Thank you.
Yeah, I mean, can you imagine the potential of it?
Absolutely.
So it's fantastic. Okay, so when you're not busy deploying data, what do you do for fun? Or maybe what we should do is just segue to the trivia section where we just really get to know you anyway, right? I guess we could do that. Okay.
Okay.
All right. So I've got 3 envelopes here, one labeled 1, 2, 3. I need you to pick one, and you pretty much just answer whatever questions we find inside the envelope. So what's your pick?
2.
Number 2. Okay. All right. Let's see what number 2 is. So number 2 is general trivia. And this is just it's general trivia, pretty much from Nigeria, the UK, just whatever it is, right? So there are 5 questions. First one is William Shakespeare. William Shakespeare was a very popular English playwright. Can you name 2 of his plays?
Oh, I think one would be Julius Caesar.
Yeah. Okay.
And can you name 2 of his plays?
Oh, you know what? I just learned about this the other day. And you would think you would know it from secondary school, but time has just passed. So
secondary school was many years ago.
Many months ago. I know.
All right, so I got one. So you help me with
the second
one.
So I'll help you out with the other one. Romeo and Juliet.
Yes.
Yes.
Who would? Yeah.
And then there's a popular one now on Broadway, Hamlet. I don't know if you've seen it. Yes.
The thing with these types of questions is you watch these memes on the internet and you're like, oh my God, how and then you get these questions when you're on the spot and your brain's like going in 1,000 different ways. So.
And that's why I tell my guests, I was like, you know what, just have fun with this. Don't be so bothered. If you don't know, that's fine. We will relearn it and remember. Okay.
I'm confident in what I know. I'm even more confident in what I don't know. So. All right.
Okay. What currency is used in South Africa?
South Africa, the currency in use is the rand.
Yes. Yay. Ding, ding, ding. Okay. Name 3 countries in Africa that begin with the letter T. T for Tom.
Oh, okay. So I think we have Togo.
Yep.
Tanzania.
Yeah.
Tunisia.
Yay! Look at you. When I was researching this, I was like, that's easy now. I could only name Togo and Tanzania, and I struggled. I was like, what is this last one? So you kind of want I just kind of ran across West Africa, East Africa, North Africa. So yeah. Yeah, and I think those are the only 3 T countries in Africa. That's it.
Yeah, actually one popped into my head, but no, the Sao Tome, but obviously it's S, so there's Sao Tome and Principe, but no, that would be S. So.
That would be S, yes. Okay, the last one, there was one I was going to ask you, but you know what, I'll skip it because I don't even think, if you're not there in Nigeria, you may not, okay, whose face is on the 500 Naira notes? I don't know. I don't know who, so let's just skip that one.
Okay, thank you.
Okay, the last one. Michael Jackson was one of the GOATs, so greatest of all time. Can we name 3 of his songs? You see how I say we, because it may be something collaborative. So let's name 3 of his songs. Okay,
so I'll name the first one. You will name the second. I'll name the
okay.
The first one is Thriller.
Okay. The second one is Beat It.
And the third is Billie Jean.
Yes, and the fourth and the fifth. We can name 10.
Okay, a fourth Man in the Mirror, and we'll stop
Man
there.
in the Mirror, yes. I mean,
So I did 3.
The guy was just GOAT. He's a real greatest of all time, like truly, you know.
Absolutely.
Yeah.
And
Okay. I
I
have fun in this segment. This was not. You actually did good.
Thank you. I hope my kids will be proud of me.
I'm sure they'll be proud. I am. I'm sure.
Although they won't be happy about the Julius Caesar, but I'll take that too.
That's fine. It's okay.
Yeah.
Like we said, secondary school for us was many moons ago. Now, secondary school or high school for them was just a year ago, right? So, hey,
exactly. Yeah.
Okay, thank you so much, Okey, for taking the time out to be here. Your company is just doing amazing work. I mean, my viewers can, see for themselves the fact that you are providing solutions, for healthcare delivery, for faster healthcare delivery, for easy access to, low and middle income earners in Nigeria to access healthcare. For those who provide it, so like you said, providing training, right? Adequate training to these folks. I mean, it's phenomenal in my book, just fantastic. And then let's not even mention this early detection disease outbreak, solution in the pipeline. I mean, this is just amazing. So thank you for the work you do, and thanks for your time on this show.
And thanks for the work you're doing on changing the narrative as well. It's very important work, and please do have me back anytime.
I will do. I just might take you. Actually, I will take you up on that offer. Definitely.
All right. Okay.
So, ladies and gentlemen, there you have it. It's been so much fun just interacting with this fantastic individual who is just doing fantastic things in Nigeria. And this is what the show Conversations with Iyobosa is all about. It's really about just bringing to light. I mean, he's already been on CNN, so I didn't need to bring him to light on my show, but it's really just showcasing and highlighting individuals, Nigerians who truly have the best interest of Nigeria at heart. And this is what happens. So onto the next episode of Conversations with Iyobosa, I say you stay safe and have a super sparkly week. And don't forget to hit the subscribe button and share this link with your friends. The goodness of Conversation with Iyobosa. Bye now.
Like the video too.
Oh, I like the video, exactly. Like. Thank you.
All right. Thank you.
Take care, folks. Bye.